Delta 10 versus Delta 9 versus Delta 8. I did want to answer that question. So, if you have a normal pot plant, it will have a little bit of CBD and a lot of Delta 9 THC. But there's a bunch of other stuff in there too. There's some Delta 8, there's some Delta whatever, there's other cannabinoids in there. But the overwhelming effect is from Delta 9 THC. But if you just take pure THC, you'll get the same effect every time. But if you have different strains like sativa or indica, indica tends to be more sedating, sativa tends to be more activating. And so that's because of those other molecules that are in there. This is the reason the FDA can't just approve marijuana as medicine, because the FDA's rules say that you have to have a fixed concentration or a fixed ratio between all the different molecules. Well, you can't do that with a plant. So unless they change the rules, they can't approve it as a drug. Now the DEA can deschedule it, and the federal government could do that. There's a certain party that's been in power, had all three houses or branches of government, and still didn't, legalize marijuana. So they give a lot of lip service to this stuff. But so anyway, some of those other molecules are Delta 8 or maybe Delta 10. I don't have a lot of experience with Delta 10, but I've got some experience with Delta 8. The thing is that as humans, we sort of, plants are our ancestors, or we are related to plants in that there was a common ancestor at some point. And, we're far branched far away, but they still have DNA. They have cell walls. We have cell membranes, but the DNA is there. The way that they generate energy is different, but we're still, related to them more than we would be to an alien species from another planet, for example. And because of that, it's interesting that our brains have cannabinoid receptors, but then our, distant cousin, 10 million times removed, the marijuana plant secretes a chemical that perfectly mates with our cannabis receptors in our brain. Why would that be? Well, it's because we're related. We both, evolved on this earth, and, nature is very efficient that it can use signaling hormones for different things in different species. And it doesn't have to keep inventing new, configurations of these molecules. Well, anyway, so, but we kind of evolved to have a lot of Delta 9 and a little bit of CBD, and then, varying amounts of Delta 8 and these other molecules. Well, when you just isolate Delta 8 and give that to people, some people will be fine. There's a natural variation, but some people will get a real dysphoric effect, or they may have like even a really bad experience with it. And it's because we're really sort of used to the Delta 9 in our ancestry and our genetics, and not so much just a purely concentrated Delta 8. That's my hypothesis anyway. I like to look at things from an evolutionary standpoint. And but anyway, so that's the deal. And the DEA has this crazy rule that they schedule certain molecules, and if you attach a methyl group or a hydrogen here that wasn't there on the or some other moiety onto that molecule, now all of a sudden it's legal, and then they have to go through the process of making that one illegal too. Instead of saying all molecules that are related to THC are illegal, they just say, okay, Delta 9 THC is illegal, so therefore Delta 8 THC is legal until they make it illegal. They just busted a bunch of places around here, apparently, because they were selling Delta 8 and they finally made it illegal. So it's always a bit of a game. I just think, let's stop playing games. Just legalize it already. Control it, sure. We don't want, 8-year-olds doing marijuana, but I think adults should be able to partake in a drug that has very little data that shows that there's downsides to it. Of course, there are downsides to everything, but also there is demonstrable positive data in patients like cancer patients and HIV patients. Why would we deprive them of a drug that we know actually works? And I'm making eye contact with the live stream. I'm sorry. This is, I'm terrible at this. Why would we do that? Why would we deprive hospice patients from a drug that would make them feel better, that would give them some relief, before they leave this world? I don't know why. There's not an answer for that. Same thing with HIV. I had an HIV patient. He had AIDS. And when he could get his hands on marijuana, he felt good. He was happy. He gained weight. When he couldn't get his hands on it because of where he lived, it was very difficult at the time. Much easier now, by the way, but couldn't get it. He would decline. So, now that's observational, but there's good, double-blind, placebo-controlled data and cohort prospective data that shows that this is beneficial in those populations. Why in hell would we deprive those people of that? And anyone who really, I don't understand it. I don't understand it. I mean, oh, well, it could hurt, it might have this adverse effect. Well, what, chemotherapy? Chemotherapy puts some people in the hospital. Some people end up with a 0.5 white blood cell count. So yes, there's downsides to everything, but as medication, THC has many positive effects. There is THC. They'll say, well, I would just give people dronabinol. That is synthesized THC made in the laboratory. And it is great. There's a national shortage on it right now. National shortage, can't get it anywhere, can't get it for anybody. A couple of the hospitals still have some because they just don't use that much of it. But we have been unable to get this stuff for our patients now for about 6 weeks. Synthesized THC, which we use for chemo-induced nausea and vomiting or anorexia due to HIV/AIDS, and a few other diagnoses. Now, we can't get it. Patients in Virginia, we just go to the dispensary. My patients who live on the Virginia line, but they live in Tennessee, they see their Virginia friends going to the dispensary. They can't because it's illegal. So I wrote letters to all of our legislators saying we need emergency authorization to allow people to buy marijuana in Tennessee. Maybe they have to go to Virginia. Maybe they can grow their own. There's always the problem with, well, if it's illegal to sell, but it's legal to buy, how does that work? So, it's just bullshit. Just legalize it, but control it, tax it. I got no problem with that. And let our patients have it anyway. All right, I'm off my soapbox. There's Akasha Nico. She's quite delightful. We met at Moogfest. And there's Kish, who Scott literally thinks his name is Kush. So when Kush is a strain of marijuana, so what is anybody surprised that Scott would make that mistake? Anyway, all right, my friends. They're finally starting to open recreational dispensaries in New York State. I went to one in Chicago just as a bucket list thing. I always said I wanted to buy marijuana legally after all this shit we went through in the 60s of, lurking around in alleys and all this kind of stupid crap. And I had friends that got busted for an ounce and, they got in all kinds of trouble and almost didn't finish college, et cetera, et cetera. And I just wanted to one time go to a dispensary and buy it legally. So I was in Chicago for a WATP event and bought some, took one dose, got so paranoid that I said, okay, no more. It's fine. It's ticked that off my bucket list, but I don't have to mess with it anymore. Gave the rest of it to one of the comedians at the event. But anyway, but I do want to see it legalized. I've said that since the day one of this show. I've been advocating for legalization of marijuana, but control, not just wholesale. Okay, here you go. Anybody can have whatever they want. We can control it. We can tax it. We can get rid of the black market, which would be nice. In my area, they are trying to compete with the dispensaries. So, the dispensaries have pot that'll wake you up. They have pot that'll make you sleepy. So, but the dealers just have a big bale of marijuana. So what do? They put a little fentanyl in this batch over here and say, oh, this makes you sleepy. And then they put little methamphetamine in this batch and says, well, this batch wakes you up. And now I've got little old ladies coming in having methamphetamine in their urine drug screen. And they've never done a drug in their life until they started doing, street pot for appetite or whatever. But anyway, well, there you go. That's what I've got for tonight. Watching Batman, the animated series. This is Tickus says, Survivor Man while smoking has to be my fondest memories with friends. Yeah. It certainly, doing something that is benignly illegal like that is a bonding experience for a lot of people. All right. DGMC3 says, find a reservation nearby. Really? Is that right? We actually have, I'm in the middle of Cherokee country. I wonder if that's true. I'm going to find out. Anyway, all right. You still have to take it out of there and then transport it. But there's Tracy with an eye. Where have you been, my friend? Sorry that I missed you earlier. And Richard Kish says, I'd rather take THC than a Valium to relieve stress. Sure. Yes. And it's not as habit forming, and it doesn't have the after effects, and it doesn't cause an increase in all-cause mortality, unlike benzodiazepines, Valium, Ativan, Xanax, Klonopin, et cetera. If you take those on a regular basis, there is an increase in all-cause mortality. You take 1,000 of those people, compare them to 1,000 people that don't take those drugs. The average age that the benzodiazepine group dies in will be earlier than the group that doesn't take it on average. And I was just on this other show. We talked about it. And grandfather, they call him Granny, said, does that mean it increases your risk of being eaten by a bear? And it's like, I guess. I mean, it's all-cause mortality. That's one way to die, be eaten by a bear. Anyway.